I don't want to sound cynical, but I think I have to, because a lot of the times it seems, and I brought this up with Oscar Raza as well, it seems that insurance companies and doctors just care about, well, not maybe not doctors, let's put insurance companies, care more about treating people, quote unquote treating, prescribing them things because it makes money. Same thing with cancer treatment, right? So somebody with stage 3 or stage 4 cancer could potentially live for another year, year and a half, 2 years, probably longer. But there's a huge financial gain that these companies get from treating these people. Um, Again, it's very hard, I think, to reverse the incentives. I'm not saying we shouldn't, I'm saying we should, but it's very
Yeah.
difficult to reverse the incentives to what you're advocating for. Um, I think the concern is always for doctors that they want to get paid fairly for their work, and maybe they won't. I don't know. It's a hell of
Yeah.
a project
Yeah.
you took
Well,
on.
look, I'll tell you what my answer to that, conundrum would be is the following. We're going to ask for the resources to carry out over this 8-year period of time the analyses of these million people as we've described. And the government will pay for it as it paid for the first Human Genome Project. The data will be available. We'll be able to prove we can reverse Alzheimer's and many cardiovascular diseases and diabetes in really effective, powerful ways. The way you convince people to change is to show your approach really works. And what this means, all you have to do is to show payers, look, if we focus on wellness with these strategies, and the strategies would include this scientific wellness, and we're going to be doing clinical trials on how you age in a very healthy fashion and so forth. We can argue that you can save literally hundreds of billions of dollars. And as a payer, you can't afford not to do that. Rather, you would take this value-based approach and say to the physicians, we're going to pay you to keep these people well, and we'll make an enormous amount of money doing that, saving in a lot of things now that cost us horrendous costs, and being able to pay for the assays that will allow you to follow each individual with this data-driven approach and everything. So I think the way to get around skepticism is success. And I think the way to get success is to have the government fund a program that proves these principles unequivocally. And physicians in the healthcare system will absolutely move toward accepting them then. See, right now, it's very easy as we start pushing wellness as a major means of saving healthcare dollars. They'll say, show me the clinical trials, show me the proof. And after an 8-year period, we'll have effectively the clinical trials and proof. I mean, what this strategy is going to do is take something like cardiovascular disease and be able to stratify it not into 2 or 3 major types, but into 15 or 20 major types. And with pharma, we'll take each of those subtypes and learn the appropriate therapy that's going to be effective in that subtype at the earliest detectable stage. And so it's thinking about medicine in very different ways, and we're going to have to prove those ways are really effective.